Larisse Moses again, and welcome back to my videos on Conn's disease, my experience with Conn's disease and a adrenalectomy. We had left off at the first video at the point where I was finally referred for surgery to MD Anderson in Houston. And just to recap, I want you to be very careful about the endocrinologist that you find and hold them to the fire when it comes to your symptoms and what the solutions are and how you're responding to meds, and watch out for diagnoses that are not true. Frankly, if I had it in me emotionally, I would probably sue that first endocrinologist because he literally lied to, I guess, to bill for more, I don't know, to justify his services, which turned out just being Zoom calls that he worked on his computer the whole 5 minutes that we talked. So I just want to caution you about that. Find a endocrinologist, even if you have to drive, which I did, who has a lot of experience with Conn's. And if you have been diagnosed or suspected of Conn's with the uncontrolled hypertension and the hypokalemia, low potassium, then you're just going to have to be vigilant. My second endocrinologist, who I researched heavily, she was great in diagnosing it, but she did not want to do anything but the medication. So finally she referred me for surgery, which is the solution if the medication, if the diuretic doesn't help, which in my case it did not. I think I was so far advanced, I'd had it for so long and didn't know it, and had been misdiagnosed, it turns out, with insomnia and with anxiety disorder, and had been on medications that made me feel worse. So just be careful when you get that endocrinologist. If they are not being as pursuing this the way that you feel they should, find another endocrinologist. And I'm not saying that surgery is the end-all for everybody. Some people respond to the medication. But if you're not responding, and if your quality of life is as low as mine was at that point, please find another endocrinologist. So I was referred to MD Anderson in Houston for confirmation and to talk about surgery. And even though it took months to get that appointment, the endocrinologist that I saw there, I'll put all of the names of the doctors in the comments, he was fantastic. That facility is fantastic. I don't have one negative thing to say about them. They help you from the minute you get out of your car to find where you need to go, to get you there. His bedside manner was incredible, but as he told me, he works with people with cancer all day long. So of course, thankfully, God put him where he is. He did go ahead and confirm and referred me for surgery. It took a few more months for me to get in with the surgeon, and by then I had had time to research her. She had done more adrenalectomies than any doctor in the United States, so highly qualified, and I was fully expecting the tumor to be removed. However, when I saw her, and I believe it was on a Thursday, and getting to Houston was not easy for me back then, but that's beside the point. I saw her on a Thursday. She said, absolutely, let's get in there. And she said, I just want to take the whole adrenal gland because of your age. If the tumor was to grow again, then you'd have to be going through another surgery. I'm 68 years old. And so I said, you're the expert. You do what you need to do. And she said, well, you have another adrenal gland, so you're fine. And so because I had made the trip, and it was not easy to do in my circumstances, I said, is there any way that you can do it this next week, and I'll just stay somewhere in this area outside of Houston? And she said, well, let me look at my surgery schedule. So my sister and I hung around waiting that Friday, and finally, a little bit before 5 o'clock, her PA called me, Amanda, and said, we're going to get you in, I believe it was Tuesday. And I was so relieved, so thrilled, so scared that it wasn't going to work. I wasn't scared of the surgery. I was afraid it wasn't going to work. And so we got a hotel room right there on campus. It's a huge campus, so that I could be in the place I needed to be pre-op at 5:30 a.m. The surgery went smoothly. Again, the hospital is fantastic. I mean, there were the usual hiccups. You know, I was left in recovery a little too long, and they didn't keep administering the pain medication because they thought I was going to be taken to my room. And there were some hiccups there, but I've got a feeling that just happens everywhere. They did keep me medicated during my 2-day stay. Everything was healing great. I was up walking by day 2. And when they discharged me, of course, I was still 5 hours away from home. That was the only complaint I've had about this experience, and that was that I did not understand that the pain I was going to be in, or that it would not be managed post-op. So if I could go back in time, and this is where I want to caution you, I would have told my PCP, I'm having this surgery. They're only going to give me 1 day's pain medication and have something set up ahead of time. Because the reality was that because they don't want to give you opioids, thanks to the opioid crisis and greedy pharmaceuticals, they give you pain reliever and gabapentin and Tylenol 500, and none of them touched the pain. So I did end up going, because it was over a weekend by then, I did end up going 5 days with major pain. It was major surgery. They went through my back, took an adrenal gland. So I would say that is really the only big mistake. I should have known, I should have been told, I should have had it set up. So please hear that cautionary tale. The other thing that I would suggest is between now and if you're going to have the surgery, lose as much of your tummy as you can, because trust me, that makes a difference on your recovery. I had pain that lasted almost a year in the front lower abdomen that I think was because of my big tummy. And it was to the point where it was even a hard knot. I thought that something was wrong in there, but they kept x-raying and saying, no, everything's fine. The upside is, within that day, I was off all but 1 blood pressure medication. And we're going to talk about that in the next video, about how post-op recovery was and where I am now. Again, please like the video. That lets me know to keep making them. And I'll see you in the next video. All right. Thank you so much.